Hello everybody and thanks for joining our session. My name's Julian Newton and I'm the Principal Social Worker in Stockport, but I'm also the Chair of the Greater Manchester Principal Social Work Network, and we're part of the network with the North West, which we really value that relationship. But when we had Devolution Manchester, it became really apparent to us as Principal Social Workers across the system with the Health and Social Care Partnership that we really needed to work much closer together, and therefore we came together as a network across Greater Manchester. This session today, we wanted to demonstrate to you how we've overcome some of the real difficulties over the last 12 months during COVID. The Greater Manchester area has been in some of the greatest restrictions for the longest period. Unfortunately, we've topped the charts with Oldham and Bolton with the highest infection rates at times in the country. It's had a massive effect on our communities. It's certainly had a massive effect on public services, and we want to actually show some footage today across the 10 authorities about how actually we've overcome some of those difficulties and pressures across our service areas to keep supporting our residents and to ensure that we are supporting our workforce as well. So we hope that you enjoy the film, and there will be some question and answer time after the film.
Hi, I'm Anne Brooking and I am Principal Social Worker for Adults in Salford, and I've been talking with our best interest assessors from Salford's Mental Capacity Act and DOLS team about the impact of the visiting restrictions on care homes. Here they share some of their experiences and reflections on how these restrictions affect residents, their family and also themselves as practitioners.
Everybody has something to say about these restrictions, and you can see over time, from the beginning of the pandemic when people were patient to now, that there's been a kind of qualitative shift in the kind of feelings that people have had. They're much more impatient about some of the things, and they all say that part of their relationship is about the physical and kind of face-to-face contact they have with families. Some of these people were visiting their families every day, and it depends on the home, but some families are struggling with the contact and the interface they're having with the home to make up for it.
I mean, just a simple example is the daughter was saying to me that her father has always been a hugger and a kisser, and it's just the family haven't been able to do that since March, but to get in there and see him, and just that human contact, that hug, that to reassure him that he is okay where he is, and that the family haven't abandoned him, because that's what they have, a guilt, a feeling of that they probably interpret it as they've been abandoned, so they want to relay all those fears.
I think our biggest role is to reassure people that we're on their side in terms of these things, and we consider their rights very important. Some people become, I have to say, a bit frustrated with us that we haven't been able to bring the full gamut of the law to allow people into their homes, and that's been a bit of a frustration.
It's very much a counselling role, so spending a lot more time on the phone speaking to family members, teaching family members how to use technology, because the care home aren't spending that time. So I'm helping a daughter how to use WhatsApp, because that was the technology that the staff were using to communicate with residents. So by doing that, then she's able to communicate. So the use of technology.
And Trent, not seeing, and it's about having that balance between the risks and family members not having the contact and the deterioration of the person that's in the residential home, because I do feel that people are deteriorating because of lack of that contact with family.
In those circumstances, when somebody's on the cusp of capacity, all our skills and experience tell us that communication skills and listening skills, face to face, and the kind of non-verbal things are essential parts of making an assessment of somebody's capacity. And they are denied to us. And when you say that somebody won't talk to you on the phone, or all the skills that you use just in introducing yourself are completely gone out the window. I think there's lots of things we do by smiling, by sitting in the background when we come into a home, we just can't do as the care worker in busy says, it's this bloke on the phone, he's a doctor, which I'm not, and then I have to explain why I'm not a doctor, and all those kind of things that go on that completely undermine your ability to think.
Then other care homes that I only see once in a while. So I think building that bond and that relationship with managers has been an important part of getting into any care home. I think it's a trust issue as well.
It's about fighting, isn't it? It is about fighting. It's not about saying, in my professional judgment, I need to make this visit. That's not enough.
One care home that's out of area has allowed the husband to visit his wife every day, which is what he did before. What they have done is they've tested him as a member of staff, who've been amazing. The care home have been outstanding to allow him to continue to visit his wife on a daily basis. So they've gone above and beyond.
So here I've captured just a few of the reflections that the team shared with me, really, but clearly demonstrating how they are working with the challenges posed by restricted access to care homes. They're continuing nonetheless in their work as best interest assessors, supporting families in their distress and challenging access where appropriate, and equally importantly, supporting each other to manage their own emotions through working closely as a team. The practitioners questioned if the quality of virtual capacity assessments could be as good as face-to-face, and they clearly demonstrated how they are applying the statutory frameworks to work with these restrictions. The team manager told me how proud he is of the team and the work that they are doing in these really challenging circumstances, and I would certainly want to echo that. Thank you very much to the Salford Mental Capacity Act and DOLS team for sharing your experiences, and I hope that others listening will have found this helpful in reflecting on your own role and how this has changed during these times of the pandemic. Thank you very much.
My name is Julian, and I come to the centre 3 days, Tuesday, Wednesday, Thursday.
Do you like coming to the day centre?
Yes, I do.
What would you do if you couldn't come to the day centre?
I don't do much to be with mother.
What do you currently enjoy doing at the centre?
Bingo, quizzes, deliveries, gardening.
Have you been keeping in contact with people at home when you've been at the day centre?
The iPad and phone.
When you come to the day centre, how do you keep yourself safe with COVID? So how do you keep yourself safe?
I get changed first, washing my hands.
Yeah.
Then when I come out, I put some of that stuff on.
The hand sanitizer.
Temperature, yeah.
Yeah, excellent. Thank you very much, Julian.
So the team, what can I say? If I put it in one word, amazing. Absolutely amazing.
They've had experiences of using their own phones to FaceTime relatives, to be with patients while they've passed away, so that the loved one knows that, you know, they've not died on their own. The way that guidance changed, it almost questioned your own skills and knowledge base, really, in terms of legislation. I couldn't be prouder, to be honest, of the team that I'm managing, because every time I've asked them to move or to do something, they've done it. You know, they've done it. We've had the conversations and they've done it, but they've done it because they care about the patient.
Think back to when all this started. I think the main thing is none of us expected it to go on for this long. We kind of thought that there was going to be kind of a winter crisis plus the kind of stuff that that we're reasonably used to. We weren't expecting that it was just going to last and turn into something that needed a complete overhaul of the processes that we were using. I was going to say a complete change in the paperwork, several complete changes in the paperwork and the systems and the way things were organised and what pathways we're supposed to follow and everything else. I think it's just the scale of it was not what we were expecting at all.
In my first assessment with somebody with COVID was through the glass, so through on a mobile phone, and it just felt like we was at a zoo. You know, people were stood on the outside looking at people in the bays. Just completely shocking, really.
And everybody steps up no matter what. Nobody refuses. I think that's what's happened in Oldham. We've always been the same. And people have gone above and beyond and worked over their hours without even thinking about it, because we obviously care so much.
There was times where it was changing every week, every 2 weeks. It was just, we'll come in in the morning and you're trying to do a workflow, and then you ask the question like, so are we doing spot purchase? Are we doing something? Like, no, it's changed, like when? So it was quite challenging that every other week or sometimes every other day we had to do something different.
As it's evolved since the start, obviously since March, our role has changed in terms of, so we're not tending to see the sort of people with lower level needs. We're tending to see sort of people, you know, the people who may lack capacity, or it's questioning the capacity. The safeguarding has increased dramatically in terms of, you know, that tends to be our main sort of role at the minute.
It's a completely different group of people, because even though they're still doing rehab at Butler Green, because it's now being used for designated beds, they're getting, you know, exceptionally complicated cases in there. People are being discharged as in more poorly than they were, because of the pressure on the hospital, and that's been very, very real pressure, where we've had people sort of stacking up in A&E, and also sort of the pressure of anxiety, where they've felt, right, we think that wave number whatever is on the way, so we need to make sure we've got capacity, and we need to get people out. Pretty much the last 12 months has been either sat in front of a computer at work or sat at home, and with an incredible increase in the number of showers and the amount of laundry that we're expected to do.
I think my main thing has been guilt, because I've got 2 children. One who has been at home, he was 12 last year, well he's 13 now, but he's been at home on his own for a year now, so the guilt is massive. My youngest son has been at school and hates it because his parents aren't key workers, so me and his dad are, and he's very angry with us that he has to have 2 parents that are key workers and has to go to school. So it's like you're coming to work to support other families whilst neglecting your own, and it's massive. That's what's done me in.
I mean, when I leave the house, I just pray and say, you know what, just protect me, God, whatever it is, just protect me from it.
Hello, my name's Bev Johnson. I'm Principal Social Worker for Adults at Bury Council in Greater Manchester. My videos are from one of our community mental health AMPs, and she's going to talk about the difficulties and some of the challenges of working in mental health, doing mental health assessments during COVID. And then we have a video from a person with lived experience who is supported very closely from our Advanced Practitioner Complex Risk. That's a bit of a mouthful of a title, but she works with very complex people who don't fit into the specialised services. So I hope you enjoy those videos, and I hope you enjoy the whole GM experience. Thank you.
Hello, my name's Kate Casey, and from an AMP point of view, digital virtual technology, IT systems have been invaluable. It's fair to say that we had an awful lot of challenges at the beginning of March and well into the summer, but I think now most people are finding a way through it all and feeling like you're part of a team, even though often we're working from our home bases, is being made more possible by things like MS Teams. From safeguarding points of view, trying to mobilise all the agencies, organising that so much more streamlined now. Training opportunities, I'd like to think that they've been enhanced by this method of communication. You can often see the trainer. The opportunity to have been given a vaccine has been invaluable, and it was reasonably timely. For us as AMPs, whereas a lot of my colleagues in the area teams have been able to prioritise only absolutely essential visits, we as AMPs have to go out, we have to intervene at early stages when we're seeing people in mental distress. We're having to assess in all different settings that we can't necessarily protect ourselves in. Fortunately, all our AMPs have managed to keep safe and well and healthy, and that's down to being compliant with PPE, trying to keep numbers down and get out of situations as quickly as we possibly can. The challenges to that have, however, been delays and problems in seeking out beds. I think that problem has always existed as long as I've been an AMP, but it's certainly in crisis point at this moment in time. Ambulance attendants, ordinarily we're given a 4 to 6 hour window for psychiatric emergencies, but that's exceeding 7, 9, 11 hours now. In our authority, we've managed to have an agreement with the CCG for us to commission private ambulances where we're having those obscene delays. And of course, the impact is that knocks onto the service and the AMP not being available to meet the needs of the wider public because we're tied up by resource challenges in a home setting.
Hello, my name is Zoe Lee. I'm a social worker from Bury Council and I work with Roy, and we've been given the task today of looking at that COVID can have some good outcomes. So Roy's story is a story of two halves really. Firstly, he had a delayed discharge because of COVID, and this kind of really impacted on him, didn't it, Roy?
Yeah.
Would you like to tell people how that impacted on you?
So basically, I come to my son, I need to leave a discharge. And what else have we got?
What else did it make you feel a bit low, didn't it?
Yeah.
Especially near the end.
Yeah, it did.
You're very close to your family, aren't you?
Yeah, really close.
In fact, Roy lives with his family at the moment, don't you?
Yeah.
So it's a story of two halves. Initially, due to staff shortages and Berry Council having to step up to the COVID pandemic, Roy's discharge was delayed. However, I was put in place at the end of October. I wouldn't usually work with people like Roy because I work complex risk, but I agreed to do the assessment, and we worked towards discharge for Christmas, didn't we, Roy?
Yeah.
Roy really wanted to be home for Christmas. We got the funding agreed 2 weeks before Christmas.
Yeah.
And the care team worked really hard, didn't we? And we did manage to get a care package in place in your home.
Yeah.
Was it a week before Christmas?
Oh wait, yeah, it was a week.
A week before Christmas.
Yeah.
How did that make you feel?
That was good. And the care team is really nice people. And it's just good to be home after all the time.
What is the best thing about being at home, Roy?
Having my own bed and not having people coming in.
Coming in and out all the time. Yeah. Anything else?
Just being at home really is good.
I've met your son, haven't I? So that was really good because you didn't see him, did you?
No.
From March last year until December this year.
Yeah.
Last year.
Yeah.
Sorry. So you didn't see your son from March 2021 until December 2021. So that was quite hard for you, wasn't it?
Yeah, it was a bit crappy.
Yeah, and you couldn't see family, your parents who you're really close to.
No.
But good outcomes.
Yeah.
You've got a lovely home, haven't you?
And it's nice. Yeah.
Living with your family.
Yeah.
Nice support team.
Yeah.
And we're working on rehabilitating you so that you can walk again, aren't we?
Yeah, hopefully.
So we've got a good care team in place, physiotherapist, occupational therapist, myself.
Yeah. Oh, I don't know about you, but yeah.
Okay, thank you.
Thank you.
Bye.
Working through COVID times has been both challenging and rewarding. Working for urgent care has meant increased collaboration with the NHS, both in the community and in hospitals. I'm really proud of how the team has developed and how urgent care has provided lots and lots of support for the residents of Trafford.
Working through COVID-19 has been both challenging and rewarding. The uncertainty COVID brought saw individuals frightened to seek the support they required. As a social worker, I saw health and social care and wider community resources pulled together to support their communities and the most vulnerable in society, the very heart of social work practice, and reinforcing Trafford's epic values by empowering communities, individuals and each other. Person-centred, ensuring support was available as individuals needed it, inclusive and collaborative, communities and organisations working together to support and maintain a positive health and well-being for the individuals of Trafford.
Hi everyone, I'm not going to lie, working at this time over the last year has been really tough. I've been doing my apprenticeship, working from home, which has been a massive change, and homeschooling my 6-year-old. It's been difficult, challenging, but it's also been rewarding because I've gained more experiences working in a new setting at Nightingale, and I'm looking forward to the next year.
Hello everyone. Working during COVID times has been stressful and challenging for the workers, the people we support, and their families. The success of the urgent care team can be defined in 5 words: creative working, flexibility, resilience, teamwork, and understanding. Thank you all.
My name's Theresa Morris, I'm a social work manager. I've been asked to describe in 5 words what working in the pandemic has been like as a social work team manager. So my 5 words are risk, change, reflection, grief and proud.
Hi, if I were to use 5 words to describe how COVID has been for me as a manager, the first 2 I'd pick is challenging and lonely, as it has been really difficult, and going from working in a busy office to being alone at home is, you know, quite lonely. The next 3 words are resilient, hardworking and dedication, because despite all the difficulties, the team and everyone has sort of pulled together to achieve what they're supposed to and get the job done.
Challenging, different, lots of compassion needed, resilience and reflection.
The situation are challenging, thought-provoking, isolating. It's been a learning experience and interesting.
Peer support, manager support, working from home, having the correct equipment to work from home and ensuring staff well-being. Thank you.
Challenge, innovation, historic, appreciation, balance.
Challenging, relationships, frustrating, change, emotional.
I feel that the social work role has, and the values of social work have shone throughout.
The resilience that we have shown as a team and the bond that we've created has been amazing.
Obviously, it's been a really tough year for lots and lots of reasons, but I think this experience, there's lots of things that we can take from it, and hopefully in the future this will be a benefit to our profession. Being forced to work from home has been something that we've found difficult and has been a challenge, but it's also made us innovate and shown that there are benefits to it and we can have a better work-life balance.
The word was proud, and I know that might sound a little bit twee, but I have spent the last year feeling very, very proud of our leaders at all levels, because they really have worked very, very hard to keep us all safe, make sure that as the best is within their gift, that we've got the resources we need to deliver social work support in the pandemic. There's been a lot of support around well-being, people's well-being, trying to keep people well. Staff have had training around moral injury. I'm proud of my own management team who have worked hard together, supporting each other, and of course we all work at a distance. We're only getting together generally over Teams meetings, and I'm very, very proud of social workers who have worked tremendously hard in very difficult circumstances to deliver social work support. Support which, to be honest, rarely receives any recognition or acknowledgement, and certainly not with the positive impact that it delivers on people's lives, which is sad. But anyway, I am so proud of everyone. Thank you.
Hi, I'm Jane Tennyson. I'm Principal Social Worker and Strategic Safeguarding Lead for Adults in Rochdale. We are so proud of our social workers locally, and never more so with the work that they've been doing during the COVID pandemic.
My name's Cassie, and I'm one of the approved mental health professionals at AMPS, working for Rochdale Council in the dedicated AMP Club. During the pandemic, we've continued to work under the Mental Health Act and the Mental Capacity Act, doing face-to-face mental health act assessments. This meant that the service user could participate fully, and also we maintained their human rights. We've continued to provide one-to-one supervision and peer group supervision for all of our AMPs to make sure that we can maintain their resilience during this pandemic time. That gives them time to reflect on difficult cases and also their own anxieties around COVID during working as an AMP. As a team, there's 4 of us, and we're very, very making sure that we're very resilient. We are making sure that we are looking after ourselves, our mental health, have given each other time to talk over our own anxieties, and that's just made our team very resilient through this pandemic.
Hi, I'm Georgina. I'm a social worker with Rochdale Adult Care Services. My experience of COVID has been challenging. It's been varied at times. It's been rewarding, and the past 12 months has flown really. It's been a mix of different experiences, but makes me proud to be a social worker.
My name is Jim. I'm a social worker on the HMR Borough-wide review team based at Council Corner. As an experienced social worker, I feel that the essence of good practice is good communication. The outbreak of COVID-19 and the physical restrictions placed upon professionals in making contact with individuals, whether service users or colleagues, has actually increased my reflection on the humanistic and effective communication needs, but without physical human interface. The impact of lockdown and mental health is something at the forefront of my practice when talking with others who are relying on support in their lives.
My name is Laura. I'm a social worker on the hospital discharge team. We help to facilitate safe and timely discharges from hospital, providing services to meet assessed need. Our team regularly supports students through learning and placements. I had the opportunity to support 2 students on virtual placements that were on the Step Up to Social Work programme. And although there were drawbacks in that they couldn't come into the placement as much as we'd like, the university sent lots of work that we were able to read and discuss in supervisions, and this really brought the classroom learning into the placement and the discussions. I felt that I worked more closely with other practice educators. We devised a bit more group work and discussions in the virtual world that added to the learning on the placements and their opportunities. My students both passed the placements and have moved on to their final placements, where hopefully they are working towards becoming qualified social workers.
Hi, I'm Claire. I'm a newly qualified adult social worker working within a generic neighbourhood team at Tameside. I've been in the role for now around 3 months. There has been quite significant challenges trying to complete my final placement and also learn the newly qualified role due to the pandemic. Obviously, a lot of those stem from around working at home and not being within the office environment, whereby you can learn the process and procedures, relevant service information more readily available from your colleagues. Another challenge would be obviously the PPE. It creates that significant barrier with the mask above your face when you are going on essential visits, seeing people within their own homes. It has been quite difficult, but in saying that, we have learned to adapt. We learned to change the way we approach situations, and we are visiting people in their home. Technology has also been great for facilitating, obviously, meetings that are needed because they can't happen in person anymore. And I suppose we've all had to learn to adapt to that, but a positive that I think has come of that is that it's made work more efficient.
Hi, I'm Hayley. I'm an adult social worker and I've been employed at Tameside since November 2020. My job involves mainly assessing those in need of care and support. I've been out of practice for almost 5 years and I previously worked as a social worker in children's services. It was during the pandemic that I was reaching out to people in the community to help those most vulnerable. It was that desire that I wanted to return to social work. So given the remote and virtual world that we now find ourselves in, the Return to Social Work programme was no different. I ended up doing all of my training online, and a lot of it was through either using Zoom or other conference calls. I think the programme and also the placement at Tameside enabled me to build on those coping skills in order to be able to do the job well. I think for me, self-care and self-awareness is vitally important to be able to do the job well and protect your own well-being.
Hello, my name is Sue Kellenbeck. I'm a social worker for Manchester City Council. COVID-19 has been the current most significant challenge for us all. Providing services for the residents of Manchester has required a lot of creativity on my part as a social worker. Direct payments has been a significant aspect of that support. Through a strength-based assessment to develop a package of care the citizen feels best meets their needs, giving them more choice, flexibility and independence around how that service is delivered. Working closely with the brokerage team from developing and finding a PA to setting up the financial mechanisms that are required to facilitate the direct payments process. Here in social work, we continue to deliver the required support our citizens need and remain safe.
My role as a direct payments coordinator is to provide advice and support to our citizens in order for them to purchase their own services. Some of the challenges that we face are supporting citizens and their families to find solutions and how to manage their own care when they are no longer able to access community care services or daycare due to the local lockdown measures in place. As a team, we've had to find new ways of working to respond to COVID-19, but also balance that with fulfilling our other roles and responsibilities. If I could think of 5 words of what COVID-19 means to me and my colleagues and the impact it has on our citizens, the first word that comes to mind is adaptable. As a direct payment coordinator, I've had to adapt to the ongoing changes to ensure that carers and their families receive the advice and the support that they need. Another word that comes to mind is responsive. Being responsive to the needs of citizens ensures that our citizens feel valued, and it shows that they are at the centre of what we do. Empathy, understanding that people are experiencing their own personal struggles, as many of us are either home working and some of our citizens are socially isolating. Another word that comes to mind is patient. Being patient with not just citizens and their families, but showing patience towards each other provides positive working relationships and have positive impacts on how care is delivered. The last word that comes to mind is positivity. I feel that remaining positive and working together to achieve best outcomes for our citizens can enable us to overcome the many challenges that we might face.
Hi, my name is Jeanette MacDonald.
I'm Tracy Tom.
Hi, my name's Tom Coulton, and the 3 of us just wanted to talk through Wigan's experience of being resilient in the face of the pandemic.
I'll never take for granted walking into a room full of friendly faces. Empty buildings just don't do the trick.
We've had Christmas quizzes, team awards, sing-songs, all done virtually, but equally as fun and ridiculous as normal.
We've had babies born in our teams and more on the way. Mummies and daddies working from home but still supporting the team, covering duty while being parents and teachers.
There have been late night Friday night drinking sessions by the teams instead of having Christmas parties.
Our lives have changed, but the friendships haven't. We've recognised that we almost took each other for granted, so we put even more effort to keep connected.
Seeing as we can't see each other face to face anymore, I love the way our colleagues offer each other peer support, whether it's via Teams or a phone call.
We've saved so much time not travelling to and from meetings and not travelling to and from the office, but it gives us more time to spend with our families and less diesel fumes in the air too.
We all have our WhatsApp groups to keep spirits up and keep connected, talking about things, anything but work.
We've attended call via video links. Who would have thought that that was possible?
Through using Teams, we know everything there is to know about each other's pets, kids and never-ending kitchen renovations.
We've all worked together to get over the COVID Scheme 1 and Scheme 2 funding projects, consistently having to respond to changing demands, being creative and being flexible.
As As managers, we've had to think differently in how we support our teams. It's been challenging, but we know that we've grown in ourselves and grown stronger as teams together.
Some staff have continued to go out and see our most vulnerable clients, albeit wearing PPE and taking all precautions.
Staff have continued to display the Wigan behaviours, being positive in the face of the pandemic and taking pride in everything that they do, being accountable and responsible for making things better for others, definitely being courageous and being open to doing things differently.
Some excellent pieces of work have been completed and we've had numerous compliments received, recognition from the public of the effort and determination of staff in such difficult circumstances.
So over a year since the pandemic began, and we've faced and overcome challenges, we've built new relationships and we've grown stronger as a team. So here's to a better year ahead. Cheers.
The art of social work, composing a clearer picture. The harsher the climate, the more that we shine. We who see people, not faults with their minds. We who see clearly all that defines the reason it is that's formed over time. We stand so that justice can always prevail in a system that's known for its proneness to fail, in a system that sees only through we who challenge and battle for the rights of the free. Let it be, let it be. No, never that. We respond to injustice and never react. Compose with the facts and knowledge we've gleaned a picture that's clearer to change what is seen. This picture we paint as artists of sorts in varying shades. We write and report much as we're taught, applying with thought each layer of truth till the best way is sought.
Hi everybody, we hope that you've really enjoyed our film. We are completely aware that we won't be in line for a BAFTA, but as you'll appreciate, trying to get 10 local authorities to work together, and many of us who've done that via our phones as well. So pulling that film together was no small feat for us, but we really wanted to take the time to really celebrate the great work that's been going on across Greater Manchester, and how we've worked as well to support our workforces as 10 adult PSWs. So I'm Julian Newton. You might have seen me at the beginning of the film with my grey roots, and I'm the GM chair of the PSW network, and I'm so pleased so many of you could join us, and I hope that the film really resonated with you. I'm sure many of you have been experiencing the same over the last 12 months with obviously everything that we've been going through. I would like to, just before, we've only got about I know another 5 minutes or so for any questions, but I would like
like to thank both Matthew and Leah, who are on the call today as well, because they've really supported us to pull this film footage together for you, and we can't thank you enough for that, because we certainly weren't any experts. At the end of the day, we're social workers by profession, so thanks very much for that. That support's been absolutely great, and we're really pleased that we've been able to share with you our story across Greater Manchester. So if there are any questions at all that you'd like to ask us at all, there are a number of us on the call who are part of the PSW network, and we'd really appreciate if there is anything we'd like to try and answer that for you. So I can't see any in the chat, and I might not see everybody's hands up, but if there is anything anybody would like to ask us, please do feel free. I think we've got 5 minutes left if there's anything anybody wants to say. So I think people hopefully have enjoyed
There's a question there, Julia, just from Steph Butterworth. So Steph, you can just unmute yourself and come in at that point. Hiya, Steph.
Hi, thank you. It's not really a question, it's just more a comment, really, just to say a massive thank you from me, you know, because it's quite amazing listening to, you know, real people talking about the things that everybody's gone through, really. So I just wanted to make that comment, really. You know, it's been a really good use of that afternoon for me. So thank you very much indeed.
Thank you very much. And you know, it is all about our workforce and the way that they've supported people, and we really wanted to showcase that, because it has been, I know, a tough time right across the country, but the length of time that we've been in some of these toughest restrictions has really had an impact on our workforce. Our social workers and our wider workforce as well have been so committed. And sometimes, you know, we absolutely respect all the work that the NHS does, but there's also a lot of work that's done out there in social care, and people have gone above and beyond, and we wanted to highlight that and showcase that today across, obviously, this event. So thanks, Steph.
Julia, I just wanted to add to that, kind of just watching it. It's Anne here, PSW from Salford. Just watching all those different reflections, I think one of the things that really stands out to me is that, you know, as social workers, we're used to working with complexity and we're used to working with conflict. There are some extra dynamics that have been expressed during that video that I think are very particular to working in the pandemic, around, you know, kind of balancing that social worker talking about how she felt guilty that she was prioritising service users and neglecting her own family, and some of the thoughts that were expressed about working with residents in care homes, and in essence working with that really basic human right about the right to personal and family life, and that being denied to people. And one of the things that was expressed to me in that was that some of the family members that people were working with actually felt resentful of the social worker, because the social worker could go in and could actually talk to them in person in a safeguarding inquiry, and they couldn't. And I think those are really difficult and challenging things that we've been working through that are very new to the situation with the pandemic, but I think they're really well reflected in some of the videos that we've pulled together.
Thanks, Anne. I'm just aware of the time now. Is there anything else anybody else would like to comment at all?
Thanks, Julia. There's a lot of really positive comments in the chat as well, and the video will be available on YouTube. So I think it will be something that would be great to be shared amongst teams and get it wider across people's networks as well. So the whole video will be available. So I really hope people have enjoyed today. I certainly have. I think I would echo what people have been saying. It's just been really nice to sit back and hear social workers' reflections over the last year, and I think that would ring true with a lot of us as well. So I think it's been a great opportunity. It's prompted a lot of reflection for myself. Just a reminder as well, if people are social workers who are here today, you can use this to continue to reflect and upload it to your Social Work England account as well, so it can form part of a CPD upload. So Really appreciate everyone's time. Really appreciate everyone coming along today. The link to the survey has been added into the chat. And again, would appreciate people just taking a couple of minutes to fill that out. It will really help us build towards next year. Thanks for everyone's time, and thanks Julia, and thanks everyone else as well. Thank you.
Thanks everyone.
Thank you.
Thank you. Bye.
Thank you.